Well, you know, nowadays you hear more and more talk about stem cell use in the medical community, but how do you know if the claims being made are real? Dr. Reiner Kramer is here from AZ Pain Centers, and he's here to tell us more about this topic. And actually, you're going to guide us through some of the claims that are being made out there. And actually, what I'm finding is you're really educating us on what to look for.
Good. Yeah. It's good to be here. There's a lot of chest beating going out there in the marketplace. And I think really the consumer needs to have an awareness and be concerned about some of the claims that are being made. It's about buyer beware, because most of these procedures in the stem cell space are cash. And I think the consumer would be wise to dig a little deeper to see where some of these tissues are coming from.
Okay.
And one of the things we're going to talk about today is amniotic or placental derived tissue.
Okay, which is often being offered to patients.
Correct.
As regenerative medicine, right?
Exactly, and
okay.
having stem cells.
Okay.
Live stem cells.
Okay, and there is an absolute difference here, and you're going to kind of give us a demonstration here to kind of help better explain it. Now, what you've done here, we have a live green plant back here, and literally just snipped a leaf from this plant. It's a live plant, and what are you doing?
What we're going to do is we're going to freeze it, because as the amniotic tissue is frozen.
And this leaf is representing the amniotic tissue?
Right, representing the live tissue.
Okay.
Because it is a thin layer. The amniotic tissue is the sac that the fetus is in, and that is harvested at birth. And then it is freeze-dried, and then reconstituted or shock thawed in the physician's office and injected. And it's often sold as having live stem cells or marketed as having live stem cells.
Okay, and why is that bad?
Well, there's nothing wrong with marketing that way if it were true. But when you have independent labs who've tested these amniotic tissues and there are really no live stem cells, they've gone to independent labs, looked at the results, and the stem cells, the few stem cells that were there had lysed due to the process, and those were no longer viable to help regenerate tissue.
Okay, so I'm a patient, I'm being told I should have this type of injection. What is the difference in having a live stem cell injection versus the frozen stem cells? What's going to happen to my body as a result?
Well, let me just show you through the example. This is now something that has been frozen.
Right.
Okay, and let's look
hold it real still.
And let's look at what happens after it's frozen. Look at how that breaks up, because the tissue and the cells have lysed due to the freezing process. And you now have essentially broken cells or tissue that is no longer viable, because
so it's not going to work.
It's not going to work.
Okay.
Right. What you want is viable, alive cells that can become chondrocytes or cartilage, especially a biologic that is being used for an orthopedic condition.
Okay, real quickly, Dr. Kramer, I need you to tell the viewers at home then what you do differently.
We take blood and bone marrow aspirate from the human being. We don't take it from another individual, because
it's not frozen.
And it's not frozen. It's live and it's warm and it's prepared the same day and re-injected later that day.
And that's what the message is, and that's what people need to know, that is the difference between having a recovery or not.
Right. Wasting money and effort versus getting the real deal.
Because like you said, it's mostly a cash business because it's not covered by insurance.
That's correct.
I loved it.
Okay.
Totally, I get it now. I get it. All right, let me give you some information in case that, you know what, you need more information. You can go to azpaincenters.com to learn more, of course, but guess what? Here's the phone number right here, 480-821-PAIN. AZ Pain Centers, they do accept most insurance plans, and they have locations statewide to choose from. One in Tucson as well, 520-742-PAIN. But you can also call this number. It's a 844 number, Regenex, or 734-3639.